Alright, so in front of us we've got our oxygen delivery equipment again, and this time we're going to discuss in a little more detail about this device here, which is a nebulizer mask. Now I just want to explain to you the different components of it. So you've got the mask itself, which does look on the surface quite similar to a simple face mask, but this attachment is completely different, so don't get the two confused. Okay, then we've got this second component, which is the nebulizer chamber, or the nebulizer bowl, and it unscrews into two components as well. And this is where our nebulized medication will go. So I'll just do that up for the moment. So, for example, if we want to give a patient some nebulized salbutamol, we actually have to draw up a very accurate dose. It's not good enough just to squeeze the ampule of salbutamol into the nebulizer chamber. Okay, we actually want to take the care to have an accurate dose, and therefore we draw up all of our medications that we wish to nebulize using a syringe and needle. Now for today's purpose I'm going to just use some saline. Alright, so let's just assume I'm going to nebulize a couple of mils of saline for this particular patient. So you can see there I've drawn up a volume of 2 mils. Alright, get rid of that into the sharp spin straight away. And this is where we open up the nebulizer chamber, introduce the liquid into the chamber, close it up, and then attach the mask on. Alright, so we have the complete unit there. The other piece of equipment that we need, obviously, to deliver this through to our patient is some oxygen tubing. So let's attach that up. And then, of course, our oxygen source, which in this case is going to be our cylinder. Now, the flow rate for giving nebulized medication is very, very important. We generally want to give it at about a 6 litre per minute flow rate. So let me just run it at 6 litres. So that's a 6 litre per minute flow rate. You can see that there in the cylinder. And what you'll notice is that you're getting a good aerosolizing of the medication there. In this case, the saline. But it could be adrenaline, it could be salbutamol, could be a whole range of other medications. Now, if we haven't run it at a sufficiently high flow rate, I'm just going to do this as an example, I'm going to take it down to 2 litres. You'll notice two things. One, the pitch of the sound is significantly lower. So that's your first thing to warn you that we're not getting any nebulizing action in the chamber there. The second thing that you'll notice is that there is now no longer any misting or any aerosolizing action happening through the mask. So basically what is happening is that all of that medication is staying in the nebulizer chamber, and the agitation provided by the flow rate of the gas passing through the chamber is not actually sufficient for it to aerosolize and exit the mask where it can be inhaled by the patient. So let's go back up to 6 litres again. So get familiar with what that particular sound is like, because that's a really easy way to tell whether you're using your nebulizer mask at the correct flow rate. And that is how we assemble and use a nebulizing mask.